In this video, I'm going to discuss the possibility of breastfeeding during pregnancy. We'll explore the risks and benefits associated with breastfeeding while pregnant, as well as provide tips on how to ensure a safe experience for both mother and baby. Can you breastfeed while pregnant? The short answer is yes, you can breastfeed while pregnant. However, it is important to be aware of the risks and benefits associated with breastfeeding during pregnancy before making any decisions. It is also important to note that each situation should be discussed with a doctor or midwife in order to ensure the health and safety of both mother and baby. What are the risks of breastfeeding while pregnant? There are a number of risks associated with breastfeeding while pregnant. Some of these include an increased risk of premature birth or miscarriage due to the physical strain on the body caused by breast milk production and nursing, an increased risk of infection, as the additional hormones released during pregnancy can weaken the immune system and make it more difficult to fight off infections, a decrease in the amount of colostrum, and the quality of breast milk produced while pregnant can negatively affect the baby's nutrition and health. The risk of ingesting toxins from certain medications or foods that can be passed through breast milk to the baby. The risk of damaging the nipples or breasts due to the extra strain on them during lactation. For these reasons, it is important for a woman who is breastfeeding and pregnant to consult with her doctor about the risks associated with continuing to breastfeed before making any decisions. An experienced healthcare professional can help determine if it is safe to continue nursing through the pregnancy or if other options need to be considered. It is also important for a pregnant woman who breastfeeds to take extra care of herself and her baby. Eating a healthy diet, staying hydrated, and getting plenty of rest are all essential for providing the best nutrition and care for both mom and baby during this time. Additionally, it is important to avoid any activities that might add undue stress or strain on the body while breastfeeding and pregnant. Are there any benefits to breastfeeding during pregnancy? Yes, there are many potential benefits to breastfeeding during pregnancy. First, it can provide valuable nutrition for the baby and mother, potentially reducing their risk of certain diseases. Additionally, breastfeeding during pregnancy may reduce the risk of preterm labor or low birth weight babies and can help the mother bond with her newborn. Breastfeeding also helps maintain a healthy milk supply for when the baby arrives. Finally, it can help the mother's uterus to contract after delivery and reduce postpartum bleeding. Therefore, if a woman is interested in breastfeeding during pregnancy, she should consult her doctor or a lactation consultant to ensure that she is taking all of the necessary precautions for both herself and her baby. Is it safe to breastfeed and pump at the same time when pregnant? The short answer is yes. It is generally safe to breastfeed and pump when pregnant. It's important to keep a few things in mind, however. First, while breastfeeding a new baby can help protect your older child from allergies and illnesses, the same cannot be said for your unborn baby. Hormone changes that occur during pregnancy can alter the taste and composition of breast milk. As a result, some babies may reject it or experience digestive issues. Be sure to watch out for any signs of discomfort your baby may be experiencing. Second, if you become pregnant while breastfeeding, it's important to continue eating well and getting enough rest in order to keep up your energy. Women who are pregnant and breastfeeding need more calories than women who are not pregnant or breastfeeding. Additionally, you'll want to make sure you're getting enough protein, vitamins, minerals, and fluids in order to support both your baby and yourself. Finally, it's important to talk to your doctor about any medications or supplements you're taking. While some medications and supplements are considered safe for pregnant women, others may not be safe when breastfeeding and pumping at the same time. How do I know if my baby is getting enough nutrition while nursing during pregnancy? It is important to ensure that your baby is getting enough nutrition during nursing while pregnant. Some signs that your baby may not be getting the necessary nutrients include having fewer than 6 wet diapers per day, being fussy or less active after feeding, and passing stool with a red tint. If you are concerned about your baby's nutritional intake as a result of nursing while pregnant, talk to your doctor or a lactation consultant. They can provide advice on how best to ensure that your baby is getting the essential nutrients they need. Does breastfeeding during pregnancy cause an increased risk of preterm labor or birth complications? The answer to this question is not definitive. While some studies suggest a correlation between breastfeeding during pregnancy and preterm labor or birth complications, more research is needed to come to any conclusive results. However, many experts agree that the risk of preterm labor and birth complications is likely small when compared with the possible benefits of breastfeeding during pregnancy, such as improved nutrition for the baby. It is also important to note that breastfeeding during pregnancy should not be used as a contraceptive method, and that pregnant women who choose to breastfeed should take precautions, such as avoiding nipple stimulation, which can cause contractions, and drinking plenty of fluids to keep up milk supply. In conclusion, there is limited evidence that breastfeeding during pregnancy increases the risk of preterm labor or birth complications. However, it may still be beneficial for both mother and baby in terms of nutrition. If you choose to breastfeed during your pregnancy, make sure to take precautions such as avoiding nipple stimulation and drinking plenty of fluids. For more information on this topic and other related topics regarding breastfeeding and pregnancy, please subscribe to our channel and leave a comment below with any questions or concerns you might have. Thank you for watching.